Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the fibular nerves, also called peroneal nerves. We have the common peroneal nerve or common fibular nerve, common peroneal nerve. It is also called common fibular nerve and common peroneal nerve, superficial peroneal nerve, superficial peroneal nerve, and deep peroneal nerve, deep peroneal nerve. These are same as the common fibular nerve, superficial fibular nerve, deep fibular nerve. Okay. So we got the three peroneal nerves or three fibular nerves. We'll go one by one. The common fibular nerve or common peroneal nerve is a branch of the sciatic nerve. This is the branch of the sciatic nerve. Sciatic nerve. Okay, sciatic nerve has two branches. One is the common fibular or common peroneal nerve. Another one is the tibial nerve. Tibial nerve is the larger division. The smaller terminal division is the common peroneal or common fibular nerve. So, two terminal division of the sciatic nerve. This is the sciatic nerve and this is the tibial nerve. Tibial nerve, and this is the common fibular nerve or common peroneal nerve. Common fibular nerve is this, and common fibular nerve has two branches around the neck of the fibula. It has two branches. One is the superficial peroneal nerve. This is the superficial fibular nerve or peroneal nerve, and another one is the deep fibular nerve. Deep fibular nerve. Okay, so we got again the common peroneal nerve is the smaller terminal branch of the sciatic nerve. Common peroneal nerve around the head of the fibula, it turns anteriorly and it is divided into two parts. One is the deep fibular nerve, another is the superficial fibular nerve. The root value of the common peroneal nerve, root value. The common peroneal nerve or common fibular nerve arises from the sacral plexus, from the dorsal division of the ventral rami of the L4, L5, S1 and S2. Okay, so we got the origin of the common peroneal or common fibular nerve. Okay, so the common fibular nerve is a branch of the sciatic nerve. Is sciatic nerve. There's two divisions. One is tibial. Another one is the common fibular or peroneal nerve that we divided into two. One is superficial peroneal. Another one is the deep peroneal nerve. Okay, this is sciatic nerve. This is the common fibular or common peroneal nerve. This is the superficial fibular nerve, and this is the deep fibular nerve. Okay, we got the formation. Sciatic nerve divides where? Sciatic nerve divides at the upper angle of the popliteal fossa, at the junction of the upper 2/3 and lower 1/3 of the back of the thigh. So, if this is the popliteal fossa, then this is the point of division of the sciatic nerve. Okay, one is going down, that is the tibial nerve, another going laterally, that is the common fibular nerve. Okay, we got the common fibular nerve. So this is our common fibular nerve. Common fibular nerve, and common fibular nerve supplies the anterior compartment of the leg and the lateral compartment of the leg. Anterior compartment of the leg innervated by the deep fibular branch of the common fibular nerve. Lateral compartment of the leg is innervated by the superficial peroneal nerve. Okay, the superficial peroneal nerve branch of the common peroneal nerve innervates the lateral compartment. Okay, we got that, the fibular nerves. Now, what are the branches of the common fibular nerve? Branches of the common fibular nerve. We have two branches. One is the superficial fibular nerve, another is deep fibular nerve. So we got that branches, but we have to know structures innervated by the common fibular nerve. Structures innervated by the common fibular nerve directly. Common fibular nerve. Okay, we got what is coming out of this part. Okay, number one, it provides genicular branches. Genicular branches that supply the knee joint. We have the superior genicular, superior lateral genicular. We have the inferior lateral genicular. We have the recurrent lateral genicular branches from the common fibular nerve. We have also cutaneous branches. Okay, cutaneous branches. So this will supply the joint, the knee joint. Okay, and we have the cutaneous branches. Cutaneous branches are the lateral cutaneous branch of the calf. Calf is the area of the back of the leg that is formed by the gastrocnemius and soleus muscle plus the plantaris muscle. Okay, so all the back muscles forms the calf. Okay, we got that. So one is there. Another one is the sural communicating nerve. Sural communicating nerve, that is innervating the skin, and it communicates with the sural nerve. Sural nerve is a branch of the tibial nerve. Okay, tibial nerve is a larger terminal branch of the sciatic nerve. Okay, you got the cutaneous branches. It also supplies the muscle. Okay, so usually it don't innervate the muscle directly. Muscular supply by means of the superficial peroneal nerve and deep peroneal nerve. But the common fibular nerve may supply the short head of biceps femoris. Okay, may or may not be. Okay, may innervate the short head of the biceps femoris. Usually, biceps femoris short head is innervated by the common fibular part of the sciatic nerve, but sometimes the common fibular nerve directly innervates the short head of the biceps femoris. So we got the branches from the common fibular nerve. So common fibular nerve is this part from here. This is the apex of the popliteal fossa or superior angle of the popliteal fossa, and common fibular nerve passes laterally towards the head of the fibula, and the common fibular nerve follow the biceps femoris medial margin of the biceps femoris muscle. There is a relationship where muscle biceps femoris. Biceps femoris inserts to the head of the fibula. At the head of the fibula, the common fibular nerve is related to the tendon of the biceps femoris and the lateral head of the gastrocnemius. Then it turns anteriorly and downward. It passes underneath the fibularis longus muscle and it divides into two. One is the deep fibular nerve, another is the superficial fibular nerve. Okay, so we can palpate the common fibular nerve here. This is common fibular nerve. Still, we can draw that. This is the common fibular nerve up to this level. We can palpate the common fibular nerve around the neck of the fibula. We can palpate the common fibular nerve. We got that. So we got the common fibular nerve or common peroneal nerve. Same thing. The old terminology is the peroneal nerve. The new terminology is the fibular nerve. Then we'll go to the deep fibular nerve. Deep fibular nerve, same as deep peroneal nerve. Deep fibular nerve pierces the intermuscular septum, okay, and it enters the anterior compartment, okay. It pierces the intermuscular septum, extensor digitorum longus, and it is in the anterior compartment in front of the interosseous membrane. This is the interosseous membrane. Interosseous membrane. Okay, this is the tibia. This is the fibula. Okay, so this is the septum here. Septum is, this is the fibula. You can draw there. This is the fibula. Okay, And we have septum here. The septum is penetrated by the deep fibular nerve and it supplies these muscles. Okay, so deep fibular nerve passes in front of the ankle joint, passes below the extensor retinaculum of the ankle joint, and it follows the dorsalis pedis, initially anterior tibial artery, then the dorsalis pedis artery to the dorsum of the foot. Okay, so deep fibular nerve is this, and it is initially lateral to the anterior tibial artery, then in front of the anterior tibial artery, then again lateral to the anterior tibial artery, passes beneath the extensor retinaculum, superior extensor retinaculum, inferior extensor retinaculum, and it accompanies the dorsalis pedis artery. Okay, so we must know the innervation of the deep fibular nerve. Muscular branches. So what muscles are innervated by the deep fibular nerve? Muscular branches, we have multiple muscles here by deep fibular nerve. Okay, suppose it innervates the tibialis anterior. Okay, tibialis anterior. It innervates the extensor hallucis longus. Extensor hallucis longus. It innervates the extensor digitorum longus. Extensor digitorum longus. Okay, so tibialis anterior, extensor hallucis longus, extensor digitorum longus. It also innervates the peroneus tertius or peroneus tertius. It also innervates the extensor digitorum brevis. Extensor digitorum brevis. So 5 muscles: tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius or fibularis tertius, extensor digitorum brevis muscle. So we may write it here: tibialis anterior, extensor hallucis longus, extensor hallucis longus, that is going to the great toe. Okay, extensor hallucis longus, extensor digitorum longus, then the fibularis tertius, fibularis or peroneal tertius or tertius muscle, and extensor digitorum brevis muscle. Okay, you got the muscular branches. It has also articular branches that going to the joint. Articular branches. Articular branches to the tibiofibular joint, to the metatarsophalangeal joint, to the intertarsal joint, to the ankle joint. We know that according to Hilton's law, if a nerve passes over a joint, it should supply that joint. It's because it is close to this joint, the tibiofibular joint, then the ankle joint, then the intertarsal joint, metatarsophalangeal joint. So these are supplied by the deep fibular nerve. Okay. Also cutaneous innervation. Cutaneous innervation. Cutaneous innervation is in the space between the great toe and the second toe. So this area innervation, the way between the great toe and the second toe, this area innervation by the deep fibular nerve. Okay, we got the deep fibular nerve. Then we'll go to the superficial fibular nerve. Okay, so this area is muscles are innervated by the deep fibular nerve. Here is the deep fibular nerve. Deep fibular nerve. Okay, these muscles are innervated by the deep fibular nerve. We got that. Okay, now we'll go to the superficial fibular nerve or superficial peroneal nerve. Superficial fibular or superficial peroneal nerve. Okay, superficial peroneal nerve passes in the substance of the peroneus longus, passes between peroneus longus and peroneus brevis, then between the peroneus longus brevis and the extensor digitorum longus. In the lower third of the leg, on the anterolateral aspect, it becomes cutaneous. Okay, and it will provide cutaneous nervation to the entire dorsum of the foot, except the wave between great toe and the second toe, and also except on the medial side of the foot and lateral side of the foot. Medial side of the foot, innervation from the saphenous nerve. Lateral side of the foot, innervation, cutaneous innervation from the sural nerve. But the entire dorsum of the foot, except this wave area between the great toe and second toe, this area is innervated by the superficial fibular nerve. It has one medial branch and the lateral branches. Okay, so we got the superficial fibular nerve innervates two muscles. What are those two muscles? Muscles is the peroneus longus and the peroneus brevis muscle. Okay, so two muscles innervated by the superficial peroneal nerve. So muscular branches, we got cutaneous branches. Cutaneous branches, we got that dorsum of the foot. Okay, up to the nail bed area, just proximal to the nail bed. Nail bed is innervated by the plantar nerve, lateral plantar nerve, medial plantar nerve. So up to the digit, proximal part of the nail bed. Okay, cutaneous branch of dorsum of the foot, except the wave or space between the great toe, first metatarsal, the second metatarsal, and the second toe. This area. Okay, cutaneous branches, mostly on dorsum of the foot, with some exception. Exception is this. Okay, muscular branches. Muscular branches, only two muscles. One is fibularis longus or peroneus longus. Okay, peroneus longus, same as fibularis longus, and peroneus brevis, same as fibularis brevis. Peroneus brevis. Brevis means short. Okay, we got the cutaneous innervation. Articular innervation, yes, it may innervate the joint here, the lateral part of the tarsal joints. It may innervate that part. So we got the branches of the fibular nerve. Now we have some importance of that. What will happen if this nerve is damaged, or there is some fracture here, some damage to the biceps femoris tendon? What will happen? Okay, lesion to the common peroneal nerve. Okay, what is the applied anatomy? Because these are lost, so there will be loss of eversion. Loss of eversion. Eversion is taking place at the subtalar joint. loss of dorsiflexion that is done by these muscles. Okay, so then we'll get the condition called foot drop. Okay, so because person cannot dorsiflex the foot, and certainly loss of cutaneous sensation on the dorsum of the foot area. Okay, if only superficial peroneal nerve is damaged, then loss of eversion plus loss of sensation here. If only the deep peroneal nerve is cut or damaged, then we'll have cutaneous loss in the wave between the great toe and the second toe. Now, superficial nerve block. How can we block this common fibular nerve? Here, if we inject here, local anesthesia, then both the deep and superficial peroneal nerve will be anesthetized. If we inject here at the junction between the lower 1/3 and upper 2/3 of the anterolateral surface of the leg, then there will be block to the superficial peroneal nerve, so we can do surgery here, okay, on the dorsum of the foot. So these are the important points. We have to know this part. And how can we identify the common peroneal nerve in the fibula? Fibula is below the lateral condyle, just lateral condyle of the tibia here. It is just lateral to the lateral condyle, below the lateral condyle of the femur. You can easily palpate it here and we'll get the fibular nerve here. It is palpable. So that's all about the fibular nerve. If you like my video, please support my channel. Please subscribe me. Please share the information with your friends. Any question, please feel free to ask me. Again, please subscribe me. Have a nice day. Bye now.